Thank you, Mr. Chairman. Today, we come together to address one of our nation's most pressing crises, opioid addiction and abuse. I would like to thank House and Senate leadership for their work on this conference report. In particular, I would like to thank Ranking Member Pallone for his tireless leadership on this issue and for being an important guiding voice on the Energy and Commerce Committee. As my colleagues before me have noted, millions of Americans each year face the devastating impact of drug abuse and addiction. As an emergency medicine physician, I have seen far too many patients who have fallen victim to this horrible cycle of addiction. I remember when a young man, blue with purple lips, was dropped out of a moving car, not breathing. He was rushed into my emergency room, and I intubated him to protect his airway, gave him naloxone and other supportive care, saved his life. But I always wondered if he had the appropriate resources once he left the emergency department to turn his life around, to get treatment, and to live that better life that we all strive for. So I've seen this crushing physical and emotional impact on medication abuse on individuals and their families. Today, we have an incredible opportunity to enact meaningful legislation to combat the epidemic of opioid abuse and help save millions of lives. In 2014, more than 28,000 Americans died because of an opioid abuse. They suffered, their families and loved ones suffered, their communities suffered. Today, more Americans die from drug overdoses than car crashes. In fact, opioid abuse and addiction have become the leading cause of injury and death in the United States. Our constituents are calling on us to act. Now is the time to ensure we provide meaningful resources and support so that millions suffering from this disorder can move forward on the path towards recovery. Sentiments, plans, and ideas are important, but they must include the resources that will allow local, state, and federal officials to implement these ideas and fully address what is truly a public health crisis. That is why I join my colleagues in demanding that our actions reflect the seriousness of this health crisis by including the necessary funding as part of the conference report we will produce today. We need funding so that law enforcement and other first responders are able to reverse the effects of an overdose and save more lives. We need funding so that patients, their families, and the public are educated on the signs, symptoms, and treatment of opioid abuse, and more importantly, how to prevent opioid abuse. We need funding so that programs we implement and support in states around the country are sustainable and make lasting, measurable improvements. We cannot let our words become merely empty promises, and in conclusion, it is critical that we ensure Americans who are suffering receive the resources, treatment, and support they need to overcome addiction so that opioid abuse patients and their families who leave the emergency department have a meaningful chance to heal and to turn their lives around. I yield back my time.